I've definitely felt the lump grow. It's starting to cause me some discomfort, just knowing that it's there and I can feel it growing.
For Lisa Vick, life has become one long wait. She found a lump in her breast in September and was diagnosed with cancer in early December. Her case was deemed urgent and she was sent to Calgary for a biopsy to determine what kind of breast cancer she was dealing with. Vick has had the results since January 18th, but now she's waiting to see a surgeon and can't begin treatment until that happens.
How many women are going from a curable cancer to an uncurable metastatic cancer that they've been waiting for treatment and now their treatment options are fewer? They have to fight it way more aggressively and their lives are at risk, all because the waiting.
Regina only has 2 surgeons who regularly take breast cancer patients. The health minister tells CBC he's concerned about Vick's long wait.
It isn't an acceptable period of time because every day, every week that passes when it comes to a cancer diagnosis, that impacts the chances of being able to treat it properly and successfully.
Here we are in February, 4 or 5 months later, and we still haven't done anything for the patient in terms of treatment. All that leads to, more advanced cases, more difficult recovery times.
The Ministry of Health tells CBC it has a plan for how to treat the likely influx of newly diagnosed breast cancer patients. It's working with the SHA to provide additional supports to Regina doctors who do breast cancer surgeries. That's so they can meet surgical timelines. It's also investing in additional lab resources and technology to improve lab turnaround times for biopsy results in the major lab centers in Regina and Saskatoon. But Vick says communication is lacking. She wants the province to release regular reports on what is being done to recruit radiologists and surgeons and to tell patients about any progress on reducing wait lists and bottlenecks.
Someone saying, hey, we do know we're working on this, we understand that there's an issue, is a huge help.
That we need to make sure that, number one, we're getting patients the diagnosis and the treatment as quickly as possible. But as part of helping them move through that system, we need to make sure that we're doing our best job that we can to provide that communication so that patients know what the next steps are and just to reassure them that they are going to get taken care of.
Vick says she wants to encourage other women in her situation to advocate for themselves and to call their doctors, surgeons, and cancer centers to make sure their cases are moving through the system. Laura Sharpaletti, CBC News, Regina.